in emergencies, like cardiologists come and they make quick and smart decision, and that is very life changing for a patient. And also in OPDs, the patient satisfactions, like if I sit in a medicine OPDs, like patients used to say lots of complaint, like vague complaints. But in when I sit in cardio OPD, it is the patients just used to come um, for the reviews, and they are very much satisfied. And that patient satisfaction after an intervention was very interesting in cardiology. And I have seen your lectures even during my MD days. So it was very useful. Like than theoretical, I use those concepts in emergency, like patient management, ADHF patients, not only diuretics are useful, vasodilators has to be given. So that was very nice. It was interesting also. So I started with Marrow. So I didn't study medicine in this 2.5 months. I was concentrating on cardiology only. Medicine part, they will include all the subjects, like 2, 3 questions from, they touched all the subjects. And I feel like if MD days, if medicine is strong, we can go with it. So actually, senior residents were very helpful. Like they used to guide us. We can do certain interventions also. For example, pericardiocentesis and temporary pacemakers. They used to give it to the at night ICUs. They used to obviously they will be there, and we can. They will guide us in the interventions. And echo most of the time before going into the uh, like cardio cath lab, we used to do the echos, and then SRs used to confirm it. So we are involved during our postings. It was very nice in PJ. So only I'm going towards PJ.
So, welcome, guys. Welcome, one and all. We are here with yet another topper interview. So, we are here with Dr. Rakavi and from Coimbatore. So, she secured rank number 2 in the common merit list and rank number 3 in the AIIMS list in the recently conducted IIMS SS. So, first of all, congrats, Dr. Rakavi. And could
Thank
you
you, sir.
tell us a bit more on yourself? So, which batch are you? Where did you do MBBS? Where did you do MD from?
So I did my MBBS from AIIMS Bhubaneswar and my MD from PJ Chandigarh. I joined in January 2019 and completed in last December.
So you're just fresh off the oven and you have straight away secured your DM cardiology seat. So
Yes, sir.
congrats! It's a great achievement to get cardiology so very recent to your MD exams. So
Thank you.
first of all, the usual question: why did you choose cardiology?
Sir, actually, I definitely I chose it after MD only, but I was interested before that only because in emergencies, like cardiologists come and they make quick and smart decision, and that is very life changing for a patient. And also in OPDs, the patient satisfactions, like if I sit in a medicine OPDs, like patients used to say lots of complaint, like vague complaints. But in when I sit in cardio OPD, it is the patients just used to come um, for the reviews, and they are very much satisfied. And that patient satisfaction after an intervention was very interesting in cardiology. And
You
it is
know,
also a wholesome branch, like clinical
as
intervention.
cardiologists have a sort of flair and charm. We can impress others very easily. Might not do some certain
Uh-huh.
sensational things. Just reading an
Yes, sir.
ECG, we take an ECG like this. We quickly read an ECG. It seems very impressive to a house surgeon or to a PG. So we
Yes,
can impress.
that is
You
also.
get a certain sort of charm. For us. It's very easy to impress both junior doctors
Mhm.
as well as the patients.
Yes,
So
sir.
yeah, Raghavi. So, how did you approach your preparation? So, when did you start your preparation for DM cardiology, and how did you approach it?
Sir, actually, I was in a dilemma like, should I join SRship as a medicine SR for 6 months and then start preparing for DM, or should I sit at home and prepare? So, I didn't prepare anything before MD. I just concentrated on medicine only. And after MD, like, though I was interested in cardiology, people used to say it's very hectic, work life balance will be difficult. So I was initially preparing for endocrinology only. Like January half, I was preparing for endocrinology, but it was very difficult for me to sit and read those huge theory, and it was not convincing at all. But then I decided I'll choose cardiology. My parents and my seniors also gave me that confidence, and then I started cardiology. and that time it was like February first week. So
of
it
this
was
year, right?
yes, yes. Like I
So
had
around two
hardly
months.
yes, 2.5 months to say maximum. I was like, whatever it is, I'll prepare for 2.5 months. Then I'll give my best, and if not, I'll again prepare for next INISS. I was in that mental state only. But so I was using Marrow during my UG time also, and PG also. Like last final year MD, I subscribed it. Even for my MD exit exams, I used to listen to medicine topics. So first thing I did was my starting of preparation was subscribing to Marrow only, and I have seen your lectures even during my MD days. So it was very useful. Like than theoretical, I used those concepts in emergency, like patient management, ADHF patients. Not only diuretics are useful, vasodilators has to be given. So that was very nice. It was interesting also. So I started with Marrow, but I never thought I'll complete it within 2 months. I start while watching videos. I was more than expected. I completed the topics one time. Though conceptually, my uh, cardiology strength was fine after watching one time, and after that, I revised for the second time with the videos. At that time, I made notes. So, and then I did MCQ so that conceptually things were clear. In two
So I
months, it
think
was very nice.
So I think one advantage of a video-based learning platform is you have your fixed target. That is, you have, say, cardiology, it's around 72 hours. So you have this fixed
Mm,
amount. So you just need to see 72 hours to finish off one revision. Whereas if you
yes.
were to start with a textbook like Brownwall, there's no end to it. You can even
Mm,
sit with it for 6 months, 1 year. You might never reach anywhere. So you have a
yes.
goal with that particular point of view. Did you have any idea? Did you read Brownwall?
No, sir, Brownwall I didn't read, but just before the exam, little important topics ka graphs and tables I just read. But maybe if would have not read also, it would have not made a difference, I thought. Mostly it
Exactly.
was
That's what I
converted videos.
Yeah, exactly. That's what I'm saying. I don't think it is required to read Braunwald right now
Mm,
for DM entrance preparation. That is, I have spoken to nearly 15 people over the past 15 toppers, those who have secured ranks within the first 10 over the past maybe 6 months. Apart from one guy, all of them have not even read Braunwald or hardly a few minuscule percentage. So I don't think it's required to read Braunwald anymore, at least for the current pattern. Things might change in the
mm,
future. So I think it's just required a focused study would be more than adequate rather than just blindly reading Braunwald. Did you
yes,
read
sir.
Pearl of Park, Ajahn disease textbooks?
No, sir, I
So did
don't
you
have them.
didn't even open them? So
Mm,
okay, yeah, so you were able to finish all of this in 2.5 months as well as revise it and make notes within 2.5 months, right?
mm. Yes, sir. Yes, sir.
So how
I
many?
can do MCQs also after that. Time
Yeah.
was there.
So what was your primary MCQ source?
Sir, actually, I used a Braunwald assessment book.
Okay, so that's how I started my DM preparation. It's a very good book actually. So
Conceptually, I get cleared after doing MCQs
yeah,
much
it's a
more
very good book.
like. Mm.
Exactly. So let me ask you. So as you were going, as you were going through these videos, so how many hours per day were you putting in just seeing these videos?
So maximum I watch 4 or 5 videos in a day, and I will do corresponding MCQs by like continuously watching videos. I get little fatigued, so
So it's four. So
I'll
four
do
five.
a
Yeah, four
hours.
five videos would be 4 5 hours per day, right?
No, no, sir. No, no. I will take time for a single video, but 4 5 videos in a day with its MCQs.
MCQs. So
Mm.
at any point did you feel saturated, like there's an information overload? Do you feel at any point like that?
No, never I thought like that. It was much more concise. Before starting, I never thought that I'll complete and I will be able to revise with the MCQs. So that was all possible. It was very concise and it was interesting also in between with the historical facts, then real life scenarios. It was
I
very
try to
nice.
I try to keep it interesting.
Mhm.
Just merely repeating the textbook doesn't make actually sense. So what I usually do for preparation is before I prepare to present, I usually don't read the textbook. I usually don't read Brownwall. I make the presentation myself. So I have certain
Mm.
ideas that these points are to be included, especially from my clinical experience as a cardiologist also. And then I go ahead, make the presentation, and finally, after finishing the presentation, I just quickly brush through Brownwall rather than going the other way around. Just
Yes,
coming
sir.
in regurgitating Brownwall doesn't make sense. So
Yes, sir.
there'll be a loss of uniqueness with it, and adding
Yes, sir.
historical concepts actually makes it much more interesting, real
Yes, sir.
life stories. So it makes it much more interesting.
I used to think from where sir used to get those things like William syndrome, that crime thing you had said. Like, from where do you get all those things, sir?
Hey, see, I've been extensively using YouTube for more than since 2005, and
Okay.
usually since MBBS days, you see a lot of videos, you get a lot of information. So it's basically from YouTube is the largest university in the world, that's why I always say. So, Rakavi, how important is medicine from the point of preparation? So, we had around 50 questions from cardiology, around 5 questions from statistics, around say 25 questions from medicine and pediatrics. So, how important is medicine from the point of view of cardiology preparation? So, is it like if you have prepared well in your PG days, can you skip it and directly go to cardiology, or should you give it a significant weightage?
Sir, I didn't study medicine in this 2.5 months. I was concentrating on cardiology only. Medicine part, they will include all the subjects, like two, three questions from, they touched all the subjects. And I feel like if MD days, if medicine is strong, we can go with it.
Go with it.
It's not,
Exactly. So it all depends upon your confidence on your MD knowledge. So how well you
yes,
prepared
sir.
during your PG course.
Yes, sir.
So did you read Harrison for medicine as part of your PG training?
So, frankly, not completely. I used Rakesh sir's video also during my MD time. And certain important topics though, Harrison, that is for sure everything, but not like whole Harrison completing underlying highlights. Not like that, sir.
Exactly.
Like,
So I think
never.
a large percentage of your preparation was based on Marrow,
Ah,
right?
yes,
Both
sir.
medicine as well as. So did you
Yes.
read about? So you were primarily interested in cardiology, at least for the
Yes,
last
sir.
2.5 months. So you would have got a chance to see gastro, rheumatology, nephrology, all those videos, right?
Yes, sir.
Yeah.
I
So
got.
if you are as part of your, if suppose you were able to rewind the clock and go back, let's say Marrow is given to you as your first year PG. So how would you approach Marrow as part of as part of your course? So how do you approach Marrow so it helps you become better in the ward?
Yes, sir. I always think present juniors are very lucky. Like first year, though, very residency will be very hectic. We'll work for 16, 18 hours and come back, and we'll not have any energy to open a book and study. So if it was there, like the little time if we had got like on the way to the ward or waiting for the rounds, we can hear the videos. Like so, first 6 months I did not study anything in my MD preparation, MD days, just working in the wards. So if Marrow was there, my clinical approach would have been much better in the first 6 months also. So it would have been very much helpful, sir.
Even I say, always the newer generation is always very lucky. So a
Yes,
generation before, the days where before I did my MD, they were forced to read the textbooks. I
yes,
belong to the internet generation where anything we straight away look at up e-medicine and up to date. Nowadays, you have gone even a further a step. You can look at your, you can look if you want to learn about a particular topic. You can learn it from an MD medicine point of view. You can learn about the same topic from a super specialist point of view also. So that is
yes,
actually a great learning experience and actually a great privilege. So if you are able to take Marrow, I say even the ideal time in the second year PG, it would be a great help in building up your concepts and making you a good physician overall. So you bought
yes.
Marrow in the final year, right? So how was it helpful in your theory exams as well as in your practicals?
Yes, sir. Like theory, like whatever is the topic, the concisely everything is covered. So we can be very confident in theory also. Like whatever is the question, whether they ask simple pathogenesis, management, the whole of the topics is covered and it is short span of time. And Viva will be very confident because conceptually when we are clear, then Viva is like cakewalk. So it was very useful.
What about your practicals? So although we advertise ourselves as a DM or MCH training entrance training program, it is actually much more than that. We don't
Yes.
stress much on like S1,
No,
S2, and
no.
all those things. So how is it useful from a practical point of view?
Yes, sir. In practical, they used to ask the real life things like how, if this patient is coming with these symptoms, how will you approach? It's based on approach, it's not just the topic. So, even if you start a topic, the Marrow guides will teach it as an approach, not only the topic per se. So, that was very nice. It gives confidence in everything, practicals and
Exactly.
theories.
So remember, it's concepts are actually king. Whether you go for your
Yes,
theory exams or your practical exams, or when you go for your DM or MCH exams, unless your concepts are set in concrete, you will not really succeed. You will always be
yes,
hesitant. You will always have a lack of confidence. Then it all comes down to pure luck. So
yes,
always set your concepts in stone or in concrete. Let it become unshakable so that so let them fire
yes,
whatever question they want. You will easily be able to answer it. In fact, if you look at it, I mean the last INSS, the NEET SS, all of it were primarily extremely
mm,
conceptual based questions. So you needed to know the subject in great detail. It was not straight one word questions. This INSS was something more different. They asked a lot of questions on basics, right?
yes,
Somewhat
yes.
bit more different. So, Dr. Rakavi, what areas of cardiology do you think are important from the INSS point of view?
So
Which
I
all
feel,
topics would be important?
so I'm not sure exactly, but they covered all the topics, and the last recent updates are very important, like recent studies from ACC, which have published. Some questions had come from that. Maybe because recent conference had been there in ACC, and others, like most of the things were, I'm not sure
So, in,
exactly, but
yeah,
congenital heart diseases, cardiomyopathies, rheumatic heart diseases. I'm feeling I can name it everything. I'm not sure
so that's
which
what in 50
topics.
questions you say that they have covered each, they've touched each and every aspect of
I feel
cardiology
like that.
with a
Mm.
special focus towards recent advances, right?
Yes, sir.
Right. So, Dr. Rakavi, how do you feel? So, how do you feel? How are your parents feeling? Are you feeling excited about going to such a dynamic branch like cardiology?
Yes, sir, very much. I'm satisfied that at least I decided at last that I'll choose cardiology. And my parents are very happy. They are also surprised. I said them, it's just 2 months. I'm just preparing for I'll next INISS only. So when the rank came, they were very much happy.
I think from my point of view and from speaking to a lot of students, Marrow has cut down the time required for learning. So for me, when I was preparing for my DM, it was around 6 months. 6 months
Mm.
of solid study. Don't go anywhere. Sit at home and start reading. That was for me.
Yes,
Right now, I think it's. I know some people who have cracked the exam by studying just 1 month. So I think,
it is
and your
possible.
average period of time for you to be extremely comfortable will be something like 2 to 2.5 months. So it has
Mm.
significantly cut down the amount of time you require for preparation. Do you
Yes,
agree,
sir.
Doctor?
Time and stress also. The stress it offers, like studying the book, understanding a new concept, but a guide saying it, relieved the stress also and the time also.
So, Dr. Raki, have you had any hands-on training in cardiology? So, you would have your cardiology postings at PGI, right?
Yes, sir.
So, how was your experience there? Were you
Sir,
inspired to take up the subject at that time?
yes, sir. Actually, senior residents were very helpful. Like they used to guide us. We can do certain interventions also. For example, pericardiocentesis and temporary pacemakers. They used to give it to the at night ICUs. They used to obviously they will be there, and we can. They will guide us in the interventions. And echo most of the time before going into the uh, like cardio cath lab, we used to do the echos, and then SRs used to confirm it. So we are involved during our postings. It was very nice in PJ. So only I'm going towards PJ.
I think that is a very important point. So, if you are inspired in a certain branch while doing your PG ship, you generally tend to take that particular branch.
Yes, sir. Like cardio SRs, they used to work hours together in the cath lab. Like 3 o'clock, they will come at 8 o'clock in the morning, go at 3 o'clock, 4 o'clock at night. But it never the environment was toxic. They are happy with their work. So that all inspired me.
Cardiologists are all workaholics. Cath lab is part of their bread and butter,
Mm.
and they sit throughout the night doing cases. It's
Yes,
all
sir.
part of a great experience. So cardiology is
Yes.
always what I say. It's a semi-surgical field. You need to
Mm.
be have aspects of a surgeon also. You need to be trained in such a way also. There is somebody
Yes.
have you cannot it's not something like medicine where you just need a patient and a book to learn. Cardiology, you actually need someone to tell you what to do, to show you
Yes.
how the procedure is being done. You need someone to guide you. So it's a semi-surgical field, and it has to be treated in such a way. You need to acquire skills. So sometimes it might not be possible even in 3 years. Then you will have to probably work for 1 to 2 years further, maybe do a fellowship. So do you have any higher aspirations in cardiology, like something like electrophysiology, structural heart disease, interventional cardiology, pediatrics, anything like that? Or are you still deciding?
So in MD, though, intervention excited me. But further, I should go and experience other things, sir.
Sure. Anyway, Dr. Rakavi, it's been a pleasure talking to you.
Thank
I've
you, sir.
hope that I've been able to extract all your tips and tricks of how to crack this exam. And I hope
Yes.
that I've been able to get your juniors inspired to take up one DM cardiology, and two, to get into a premier institute like PGI Chandigarh. Such an privilege to study in a center like PGI Chandigarh. Especially you have done your MD there, and you'll probably do your DM also there. See, all the best, Dr. Rakavi, and all the best for your future endeavors. And please do keep in touch. Thank you, Doctor.
Sure, sir. Sure. Thank you, sir.